Well, good afternoon, everyone. Before we get started, I'll give you an update on the figures and apologies for the delayed briefing today. There's been a virtual sitting of Tynwald which I needed to attend. So the updated stats at this current time are in total we have undertaken now 1,730 tests. We're waiting results for 205 of those tests back, which means we currently have 1,525 concluded tests. The total confirmed cases now stands at 150. The number of current hospital admissions confirmed remains at 6. And the total presumed recover figure now stands at 73, which means we have active cases of 76. Before I move on to the detail of today's briefing, I have a short statement I wish to make. The Chief Minister has developed mild symptoms of COVID-19. As a precaution, he immediately self-isolated and dialed 111. In line with the advice he received, he attended the testing centre earlier this afternoon and was tested and is awaiting the results. The Chief Minister is working as normal, remotely from home, and continues to chair the National Strategy Group and the Council of Ministers. It is important to emphasise that he is displaying mild symptoms and he remains in full control of the day-to-day running of the government. Moving now on to the main part of the briefing. The safety of health and care staff, our frontline workers in the battle against coronavirus, is an absolute priority. Without staff doing their jobs, we will not win the battle. As mentioned briefly yesterday, the NSC main sports hall is currently serving as our storage centre. Over the weekend, a large consignment of equipment, including medical devices and other equipment, arrived in the island and was unloaded, checked and prepared for dispatch. So throughout last week, staff from DOI and across the government prepared to receive and manage the goods and building up of a growing storage base there at the NSC. It was largely a logistical exercise, as knowing what exactly we've got, who it's been allocated to, and making ready for the deliveries and dispatches, and is what will make this an efficient operation going forward. Equipment is being sourced from around the world. From the scrabble to get hold of supplies at the start of the coronavirus outbreak in Europe, things have now settled down. We have orders with reliable suppliers. We are using contacts and forging new ones. Our needs are the same as any other part of the British Isles, but getting supplies safely in place, ready for transportation across the water to our island, adds another link to the supply chain with obvious pitfalls. I am therefore extremely proud of our team at DHSC, who with the support of the Department for Enterprise and the Cabinet Office have searched far and wide relentlessly to get their hands on what we need. They have done an absolutely magnificent job. It isn't just a case of putting in an order, it's following up, forging trusting relationships with suppliers that make the difference when push comes to shove. I've talked often about the need to flatten our curve, to prevent our NHS being overwhelmed, and in order to predict what the demand on the hospital will look like, we have modelled a number of different scenarios. Those that are watching us on the live stream will now be seeing a graph, or I hope you'll be seeing a graph anyway. The blue line is what is likely to happen if we do not control the virus and has happened in other parts of the world. The red line is our realistic planning assumption in DHSC. This is being monitored carefully over the coming days and weeks in order to predict the likely outcome of the measures agreed by Council and Ministers. In order to achieve this planning assumption and the optimal position below, which is the orange line, this will require everyone to continue to follow stringent guidelines regarding staying at home and social distancing, and ultimately help ensure our health and care services are able to cope with the demand. The crosses on the green line represent the number of cases that we have actually had. I will ensure that this graph is released on social media after the conclusion of this press conference and is also updated daily for public information. But people will see from the graph just how important it is that we do flatten out our curve and we follow more the trajectory of the red line, or even in the best case scenario, the orange line, than be following the blue line, which would put extreme pressure on our health services. In my speech this afternoon in Tynwald, I stated that we are strengthening our armour against this virus. The work I have outlined above is some of the work that we can do, but you can help us. Stay inside, social distance, strengthen our armour, let's hit that orange curve. Local printing company Words and Spaces has adapted its digital die cutter to make facial visors to be used at Noble's Hospital. Using provisions they had in stock, they are working free of charge with crowdshield.im, who are making the frames. These will be delivered to Nobles as soon as possible. Digital die cutter can make one visor every 30 seconds with all the necessary standards and checks in place. So I would like to say a very, very big thank you to them for the work that they are doing. I would also like to give out a shout to Laxey Lifeline. This community-based group is a central point for all information relating to Garth residents. They are helping with shopping, updates and a friendly voice. Set up early on in the current coronavirus measures by 3 local residents, the group has over 400 members and is growing all the time. The group have also been working with Laxey commissioners. Full of useful information and support, the group can be contacted by email at laxeylife@manx.net. So once again, that's laxeylife@manx.net, or by calling 474747, or through their Facebook page, Laxey Lifeline. Also, the Isle of Man community meals donations have been delivering on average 30 to 35 meals a day around the island. This small group, run by Sammy and her husband Gareth, started when she realised that vulnerable or elderly people needed support with pre-made meals. There is no cost for the dinners, but the group obviously rely on donations to run this non-profit support group. They have had a lot of support from the community, and I know the meals have been greatly appreciated and received. And also, as Minister for Health and Social Care, I would like to say a big thank you to our mental health services, who, despite the added pressures and the extra workload that they are experiencing at this time, have been working super hard out and about supporting our community. So can I say a huge thank you to everyone who works in mental health in whatever form that may be, and the continuing support that they're offering to our residents. And I will now take questions. And first up today, we have Josh from ITV.
Thank you, Minister. I hope you're well, and obviously we hope the Chief Minister is well as well. We've all heard about the UK Prime Minister Boris Johnson now being taken into intensive care, and now obviously the Chief Minister is self-isolating, which may cause a lot of worry and concern to people self-isolating as well. So as a reminder, what stage should people be contacting the 111 service so they know they're not leaving it too late? Because we've seen how fast this virus can escalate in the Prime Minister's case especially.
Yes, I mean, obviously in relation to the Prime Minister, it's a different case in point because he'd already been diagnosed. He'd had the symptoms past the 10 days where it would have been expected the symptoms to be subsiding. So obviously his condition then deteriorated. In relation to people contacting 111, if they haven't had a test and they are showing symptoms, they should contact 111 initially to speak about their symptoms and see if they require a test. If they have already been tested and the symptoms are not improving or they actually start getting worse, then they should once again speak to 111. I want to reassure everyone that the Chief Minister's symptoms are mild. They are the usual symptoms which we have put out there for COVID-19 of a fever and also a continuous cough. He continues to run the government. He is working remotely from home. I'm sure he's probably listening to this briefing as we actually speak. I've spoken to him twice already today, and he chaired the National Strategy Group this morning remotely, of course, before going to be tested himself today.
And are there any updates on dates for the on-island test centre and what progress has been made on that facility? And also, can you remind people of the benefit that having this facility will bring to the island?
Yes, so we're looking like we're about a week to a week and a half away from the On-Ireland Test Centre at the moment, so we're still on course for the timescales we set out initially. The big benefit of it is it means we'll be able to process tests on Ireland. UK testing labs are obviously coming under extreme pressure as the UK is now trying to ramp its community testing up again. So they have moved from doing 6,000 tests a day in the UK to 8,000, still a long way from the target they've set themselves of 25,000 plus tests a day, but obviously that pressure will continue to increase and the capacity of the labs is only so much. So by having our own facility on Ireland, it means we'll be able to get our results back an awful lot quicker than we are seeing perhaps in some circumstances now.
Thank you.
Okay, turning to Tim from Manx Radio.
First am I, and obviously sincere best wishes to the Chief Minister on a very speedy recovery. Are we seeing in the new cases, the curves are really interesting and take us right to the end of June, I noticed as well. Are we seeing that new cases are now being passed on within households, or are people catching COVID in more isolated ways? And of the initial cases first reported, and we've spoken to a few, was going to Cheltenham Horse Racing Festival a factor?
Well, different people had different travel history. So Cheltenham Horse Racing Festival, I wouldn't say was one of the big travel reasons. It was, I think there was a couple of people who'd been off island to various different events that came back, but it certainly wasn't one particular, should we say, breeding ground for bringing it back into the island. The different people had different varying travel history. There's no sort of hot spot, as you would call it, in relation to travel history in that regard. In relation to spread around the community, yes, we are seeing family transmission. As you would expect, if people are sharing the same household, someone starts showing symptoms, then there is a high likelihood that other people, particularly if it's a confined household, are going to start experiencing those symptoms as well. What is important from our point of view is stopping the virus from spreading outside of that household into other households, and that's what all of these social distancing rules that we've put in place is about, where we are saying with the daily exercise, for instance, people can go out and exercise with members of their own household, but they should not be coming into contact with anyone outside of their household group, and that's precisely the reason why we have those rules.
And just in Tynwald, you gave a little bit more detail on the figures, again, of people that are in wards 1 and 2. I think 6 in total have tested positive. Would you take us through those figures, and maybe could that be part of the daily briefing?
So yes, I can give you those figures, Tim, if you bear with me 1 second. In relation to across the hospital, I was asked obviously how many patients called wards 1 and 2 house, first of all, if they were at full capacity. The answer is 40, but as I've explained at a press briefing before, we are doing work around Newlands to give us 50 beds there as well, an expansion of the Newlands area up at Nobles. In relation to current hospital admissions, there are 17 that are currently awaiting results, and there are current 6 current hospital admissions, so in total that makes 23.
And 2 in ICU, is that right?
And 2 in ICU.
Thank you.
Next up we have Chris from Energy.
Good afternoon, Minister.
Good afternoon, Chris.
Wishing the Chief Minister a full and speedy recovery from the symptoms he's experiencing. Can we have some clarity in regards to the chain of command in government over here, should the Chief Minister be unable to carry out his job as normal?
That isn't a scenario that is in play. I need to stress that again. The Chief Minister is in charge of the government. He is still running the government. He is quite capable of working remotely from home and doing exactly the same excellent job that he's been doing throughout this outbreak so far. In relation to the chain of command, all ministers, myself included, have delegations in place appointing other members should they become incapable of exercising the functions of the office, and those delegations can be activated by the Cabinet Office should that situation emerge. At the moment, we're not in that state of play. I stress again, the Chief Minister has shown mild symptoms. He has done exactly the right thing. He has self-isolated immediately. He has rang 111. He has been for testing, and obviously we now await those results. But he is continuing to operate the office of Chief Minister as he would normally.
Thank you. And also, there have been reports that key workers are being stopped while out and told they need letters or permits to prove they are indeed key workers. What guidance is being given from government to the police, as some posts seen on social media aren't quite in alignment with what government orders are saying?
Well, in terms of the government orders, key workers should have evidence of why they are out and about, so they should have some evidence with them. I know certainly there's been government officials that have been stopped. In fact, I believe the Attorney General was stopped the other day by the police to ask what he was doing out and about. So it shows actually the system is working. The police should be stopping people and asking what they're doing. There is absolutely nothing wrong with that, as I've said at previous briefings. So people should be able to evidence why they are out and what they are doing, and that includes key workers.
Thank you very much.
Okay, next up we have Jess, Alaman Newspapers.
Hello, Health Minister. Our well wishes to Chief Minister too. So we've heard concerns about PPE disposal in hospital. It's believed that it is not being done with staff's safety in mind, and therefore could be a contamination risk. Could you talk us through the procedures of PPE disposal, especially concerning that of Noble's Hospital?
Right, in terms of the disposal of PPE, it has to be done in a clinically safe way. It's exactly the same procedure that's followed, so for instance, with other what would be termed clinical contaminants. So for instance, needles, etc., there's set procedures in place as to how they're disposed of. There's also set procedures around how gowns should be put into clinical waste bins, etc. There is procedures as to how gowns are put on and removed to minimise people's contact with the actual fabric as well. All those procedures are in place, and certainly I've heard no reports at all that is not being followed. I will speak to the Department of Public Health, but my understanding is all those procedures are out there, staff are aware of the procedures, and as far as I'm aware, they're being followed.
Thank you. My next question is, what support will be given to island residents due to be repatriated while they are waiting in the UK in terms of travel and accommodation? It's likely to be some time before they can leave, and they may have a bit of difficulty finding somewhere to stay.
The residents that are in most difficulty are basically those that are outside of the UK, because they are spread all across the world. And one of the reasons, as I explained yesterday, why we are saying that repatriation might take 5 to 8 weeks is because those residents have to get back to the UK in the first place in order for us to repatriate them back into the island. So, with the best will in the world, with lockdowns around the world, and relying on the Foreign and Commonwealth Office to maybe run repatriation flights from certain countries, it's not going to be an instantaneous process. At the moment, being blunt, there is no support packages in place. That is something that we are looking at, and we will look at as part of the repatriation scheme to see what support, if any, we can put in place for people, and that will be announced as part of the measures when they come forward over the next week. But one of the key things I need to emphasise is obviously those that are already in the UK will be the first tranche to come back to the Isle of Man, because they are literally already in the UK and not scattered further afield. But the reason I gave yesterday, and I explained at the briefing for the 5 to 8 weeks, is there's a lot of people who are as far afield as Canada and Australia, and that is going to take some time for those people even to get out of those countries, let alone actually get back into the UK.
Okay. Thank you very much.
Okay, next up I have Rob.
Good afternoon, Minister. We too wish the Chief Minister all the very best and wish him a very speedy recovery. First of all, just regarding the graph that you put up before, I've just been shown a picture of it. Correct me if I'm wrong, it seems as if now you have enough data to start developing a pattern of some sort, and you mentioned that these figures and the graph are going to be going up on social media. Just like with the daily cases that you keep informing us on, how often will this graph be updated? Will it be something that happens day by day, each week, or even further than that?
So this will be updated each day, because the green line on the graph that people can see it actually shows the real cases. So that's what we're actually seeing in real life, basically, on a day by day compared to the rest of the curve. We do have, obviously, some data. People will see from looking at the green line, it is still sporadic. We do need at least another week or so's worth of data to be able to see if there is any trend data emerging. Obviously, all of the measures we have brought in are about ensuring that in the worst case scenario for us is the red line. The best case scenario, with the one we really, really want to aim for, is that orange line, and we stay as firmly away from that blue line as possible, because that is the line where our health services are hitting capacity. Now, the data we have so far tends to suggest we are trending more to where we want to be, but it is still early days, and I do need to emphasise that we do need a lot more data before we can start making key decisions off the back of that.
Thank you. My second question comes off the back of Jess's second question, actually, regarding the repatriation. In a situation where someone does make it back to the UK, they make their way to Haitian port, and they end up showing symptoms of COVID-19 and they're turned away. What advice and guidance would be given to them at that point? Because they'll still have to find accommodation and potentially look for healthcare in the UK, depending on how bad their symptoms are.
They will indeed. In terms of healthcare provision, as I made clear in Timble today, there is a reciprocal health agreement between the Isle of Man and the UK, so people can access the NHS in the UK, the same as they would access the NHS here. Manx residents will be treated in the UK should their condition require NHS treatment. In relation to them being turned away at the port, they will have to find accommodation. You're quite correct. At the moment, as I say, there is no packages in place, but the repatriation scheme is still being worked up, including the individual detail, and we may be able to give more detail as it develops over the next week.
With that accommodation in mind, how do you know that these sets of accommodation that they're looking for are secure? Do you have to have conversations with the places they're looking at because they're looking at a potentially symptomatic COVID-19 patient?
No, we wouldn't. That would obviously be down to any accommodation provider, and they would need to ensure that they had suitable accommodation. If someone is already in the UK, you would expect them to already have accommodation in place. Certainly all of the people who've contacted us already have accommodation they can stay at, and in some cases long-term accommodation because they're in the UK with friends or with family that they're able to stay with. In the event that they were symptomatic, we would expect them to be staying there because the household they've already been with would also, under UK guidance as well, have to self-isolate. So we are not aware of anyone in a vulnerable situation that does not have accommodation in the UK. Certainly that has not been brought to our attention from anyone who's contacted us to date.
Okay, thank you.
Okay, next up I have Paul, MTTV. Good afternoon,
David.
Paul.
I'm just double checking. You said the Chief Minister's had a test. Now, your website this morning was showing that just under 100 people were awaiting a test. So was he fast-tracked for this? And what timescale is it now before we get that results from him and other people in the system at the minute?
No, the Chief Minister was not fast-tracked for a test. I categorically make that absolutely clear. We don't have a backlog of testing. I think the figure you've been looking at, Paul, is those that were due for testing today. The figure of 92 that have been tested today. So we don't actually...
Looking at awaiting tests, it was 98 this morning. It's dropped to 57 on your 4 o'clock update. Awaiting tests.
The away...
So basically people in the queue, are they waiting to get...
So they are people who have contacted and they have been testing. In total, we've tested 92 people today, and testing was still ongoing at the time those figures came out. So don't forget, so that's the important thing. You've got to remember with the awaiting test, it includes those who have still got to be tested over the remainder of the day. It doesn't mean there's a backlog of testing. We've actually caught up the backlog of testing. We went through a period, if you remember, a couple of weeks ago, where due to the availability of swabs on the island and also the demands on the service, we were having to book people 48, in some cases 72 hours ahead. That is now not the case. The overwhelmingly vast majority of people who be tested within 24 hours are being referred up, and that is no different with the Chief Minister. The Chief Minister has waited his turn in the queue.
And secondly, the 2 people in intensive care, can you give us some sort of status, and are they on ventilators?
I can't give you status. I can say, yes, they are being ventilated. I can say that, but I can't give you any status on them because, again, patient confidentiality comes into it.
Thank you.
Okay, next up I have Alex, BBC.
Hello, Minister.
Alex.
Just regarding the Chief Minister, of course, we send our best wishes to him as well. I'm aware that you mentioned he was in discussions with the UK government yesterday. That actually leads me on to a question. Are you able to actually give any details of the areas of discussion and negotiation between the Cabinet Office and Her Majesty's government?
So we have a very strong relationship with the UK government, as do all the Crown dependencies. The other Crown dependencies were involved in that call as well. We have discussions on various things, including NHS supply route chains, the movement of goods, particularly PPE equipment, etc. Oxygen is another thing that we constantly discuss with the UK around our supplies and logistics. So it's mainly logistical calls from the Ministry of Justice, making sure that what is in place works for the Crown dependencies, and them offering us their support to ensure that the UK can help facilitate things where they can. Obviously, the UK has much bigger buying power than the Isle of Man or the other Crown dependencies, and so we do appreciate that level of support, and particularly the swiftness with which the UK government is supporting us.
So with the likes of PPE, is that actually procured for the DHSC via the UK's NHS?
We use a mixture of supply routes. So some of it we procure via NHS supply, others we secure via routes further afield. So we have, as I think I've mentioned in press briefings, sourced some PPE from China, etc., to ensure that we have robust stocks in place. But our key chain of supply is NHS supply chain. That is the most efficient price-wise as well. And also we maintain that close link with the UK, which ensures that we can get the stock when required.
Thank you very much.
Thank you. Okay, Jess, did you have another question?
No, not from me.
Sorry.
Thank you, though.
Okay, well, thank you very much, everyone. I'll see you again tomorrow at the press briefing, when I believe I will have the Chief Constable with me. Thank you.